The world's first needle-free diabetes test has been developed right here in Australia by our scientists. It's expected to be available within 2 years. The glucose biosensor has the potential to help close to 500 million people around the world living with diabetes. The federal government has agreed to tip in $6.3 million to establish a factory to manufacture the revolutionary saliva test. The research has been led by Professor Paul Dastoor at the University of Newcastle. He's a physicist and director of the Centre for Organic Electronics. Paul Dastoor, welcome back to Breakfast.
Thank you, Fran. It's lovely to talk to you again.
Paul, can you explain how this test works? What's so groundbreaking here?
Yeah, so what we've done, Fran, is we've been able to develop sensors that we can print using electronic inks that can detect glucose at concentrations that are 100 times lower than the glucose is in your blood. And that's important because glucose is in your saliva, it follows your blood glucose concentration, but of course it's at that very low concentration, 100 times lower.
So I'm stuck at sensors you can print. How can you print something that will test your glucose level in your saliva?
Yeah, it's amazing, really. We work with a set of remarkable materials known as semiconducting polymers. So we're used to electronic materials being hard, rigid things like silicon and so on. But we work with polymers that are electronic materials, but we can create inks. And so we can literally print, in this case, transistors. And we print them using reel-to-reel printing machines that you would use, for example, to print newspapers, or in our case, the machine we use is normally used to make wine labels. But we're able to print thousands upon thousands of transistors, sensors, at really low cost.
I think last time we spoke to you, it was about printing solar panels. Is it the same essential process technology, but you're shifting it somehow to these saliva sensor tests?
That's exactly right. So we are continuing to pursue that printed solar work. In the case of a solar cell, it's a semiconducting ink sandwiched between two printed electrodes. In the case of a transistor, we add a third electrode and we make a transistor, which is a natural amplifier.
These sensors, you mentioned earlier that there's just a tiny amount of glucose in saliva. That's previously why, the test to date has been blood. How do you get the sensors powerful enough or sensitive enough to measure that tiny amount of glucose in the saliva?
So this is what we've been working on, for the last 20 or so years, Fran. What we're able to do is, because these inks are all based on carbon, and biomolecules, things like enzymes, are also based on carbon, we've been able to stir them directly into the transistor ink and then use that right at the point where the transistor is most sensitive. And so we embed, for example, in this case, an enzyme for glucose right in the transistor structure, and that's how we get that amazing sensitivity.
Okay, so in this case, for the diabetes test, you embed the glucose oxidized sensor there, but could you embed something else there? Is this essentially what might be called a platform technology that you can adjust for other diseases, to test for other things?
That's absolutely right. Indeed, we're already working with colleagues at Harvard on a sensor for COVID, and we are also now working on sensors for other biomarkers, for cancer, for hormones, for allergies. So you're absolutely right. It's so exciting because it is a platform technology. In fact, we've yet to find a biomolecule we can't put into the structure.
This sounds groundbreaking. There's so many people with diabetes around the world and that number's going up all the time. How long I think you're going for approval with the Food and Drug Administration in the United States. How quickly do you think you might get that? Are you confident you'll get it? And how quickly could you roll this out?
Yeah, look, we're anticipating having this factory up and running within about 18 months. We're working
through Newcastle?
In Newcastle, working through regulatory approvals now, and so I'm hoping that within 2 years we'll have product ready to roll.
And what about the COVID test? How quickly might that be there?
I think that will follow soon after. In fact, that's accelerating very quickly. And of course, COVID at the moment is managed through emergency authorization anyway, so that will also be accelerated.
And Paul, this funding from the federal government, which is, I think, matching funding, is from I think it's called the Modern Manufacturing Fund the government announced to develop homegrown manufacturing capacity. Is this factory in Newcastle, will that be the only factory, or will you be ramping up to build in other places, to print in other places?
Yeah, so we're very excited. We managed to secure the funding from government, and that will be matched by our commercial partner. So that's about $12.6 million to build a factory, which will then act as the template for factories elsewhere in Australia and around the world. So it's really the first part of creating, if you like, a cookie cutter approach to these manufacturing centres.
It's so exciting. Paul, thank you so much and congratulations to you and the team.
Thank you very much, Fran, and thank you for your interest.
Professor Paul Dastoor, Director of the University of Newcastle's Centre for Organic Electronics. It's a real game changer, that one. If you can just do a saliva test for your glucose levels rather than a blood test, that would be so much easier for all those almost 500 million people around the world who are testing daily for their glucose levels.